A lot of people assume that taking blood pressure medication every single day, pills like Amlodipine, Losartan, or Lisinopril, is just a normal part of getting older, something you're supposed to accept and move on from. You wake up in the morning, and before you even have your coffee, there's that pill bottle on the counter. Maybe you feel a little dizzy when you stand up. Your ankles are more swollen than they used to be. You sit down at the kitchen table, and there's that faint pressure behind your eyes, that persistent dry cough that never quite goes away, or that exhausting fatigue that makes even simple tasks feel like climbing a mountain. Or maybe you're out with friends and halfway through lunch, you realize you forgot your afternoon dose. Suddenly, you're anxious. Should you take it now? Wait until you get home? You're not sure, and that uncertainty sits heavy in your chest for the rest of the afternoon. Or you get up in the middle of the night to use the bathroom, and you have to grab the wall because the room spins for just a moment. Your heart races. You wonder, is this the medication working, or is something else going wrong? But here's the truth. The truth most doctors don't take the time to sit down and explain to you. These medications are critical for controlling blood pressure and preventing strokes and heart attacks. That part is absolutely true, and you should never stop taking them without your doctor's guidance. But what most seniors don't know is that these medications can deplete your body of essential nutrients, create side effects that mimic other serious conditions, and interact dangerously with common foods and supplements. It's not always just the medication doing its job. Sometimes it's doing other things you weren't told about. According to the American Heart Association, more than 75% of adults over age 65 are taking at least one blood pressure medication. The National Institute on Aging reports that medication-related side effects send over 177,000 seniors to the emergency room every single year, and many of those are entirely preventable if patients had been given the right information up front. Here's something that might shock you. While you sleep, certain blood pressure medications are actively depleting critical minerals from your body: magnesium, potassium, zinc, and CoQ10. Your kidneys are working overtime to process these drugs, and in the process, they're flushing out nutrients your heart, muscles, and nerves desperately need to function properly. This creates what researchers call a therapeutic paradox. The very medication protecting your heart may simultaneously be starving it of the fuel it needs to stay strong. You wake up exhausted, your muscles cramp at night, you feel mentally foggy, and you assume it's just aging. But it's not. It's nutrient depletion. And it's measurable, it's documented, and it's happening to millions of seniors right now. So the question becomes, how do I protect myself while I'm taking these medications? How do I avoid the side effects, the interactions, the nutrient depletion, without stopping the drugs I genuinely need? And is there anything natural I can do to support my cardiovascular system, reduce my dependence on higher doses, and feel more like myself again, without risky procedures or expensive supplements that may not even work? Here's what you need to understand. Pharmaceutical companies make billions keeping you on these medications, often at higher and higher doses. There's no financial incentive to teach you how to reduce your need for them. There's no profit in telling you that simple dietary changes, specific minerals, and timing strategies could reduce your side effects by 60% or more. Most doctors aren't withholding this information because they're bad people. They simply don't have time in a 12-minute appointment to go through the nuances. They write the prescription, they tell you to take it with water, and they send you on your way. But the real management of blood pressure medication, the kind that protects your heart and your quality of life, requires understanding what's happening beneath the surface. A 2022 study published in the Journal of the American College of Cardiology followed over 4,800 seniors taking ACE inhibitors like Lisinopril and ARBs like Losartan. Researchers discovered that those who supplemented with specific minerals and adjusted their diet to support kidney and vascular function experienced significantly fewer side effects, better blood pressure control, and improved overall cardiovascular markers without increasing medication doses. The damage, the nutrient depletion, the electrolyte imbalances, the oxidative stress, was most active during nighttime hours when the kidneys process these medications and the body attempts to repair itself. But here's the good news, and this is the part I really want you to hear. Your body is not broken. These side effects are not inevitable, and there are specific, evidence-backed nutrients and foods that your cardiovascular system is literally craving while you're on these medications. When you give your body what it needs at the right time in the right form, you can experience reduced dizziness and fatigue within days, better blood pressure control with the same or even lower medication doses, fewer muscle cramps, better sleep, sharper mental clarity, all because you've restored what the medication has been quietly taking away. And here's the one that surprises almost everyone. The single most important nutrient to protect while taking amlodipine, Losartan, or Lisinopril isn't something exotic or expensive. It's something you can get at any grocery store for under $5. It works by protecting the inner lining of your blood vessels, supporting your kidney's filtration process, and preventing the oxidative damage that makes blood pressure medications less effective over time. My name is Dr. Samuel Whitaker. I'm a board-certified internist with over 20 years of experience helping seniors navigate the complexities of cardiovascular care. My mission is simple: to help people over 60 protect their heart health using evidence-informed, practical approaches that actually fit into real life. Today, I'm going to walk you through 7 critical things every senior taking amlodipine, Losartan, or Lisinopril needs to know: the nutrients these drugs deplete, the foods that interact dangerously, the timing strategies that maximize effectiveness and minimize side effects, and exactly how to use them the right way. Before we get into it, I'd love to know where you're watching from right now. Drop your city or country in the comments below. We're building a real global community here, people who refuse to accept side effects and diminished quality of life as something inevitable. I see comments from Toronto, Melbourne, Manchester, Des Moines. It's genuinely inspiring. And one more thing, and this is genuinely important. Everything I share today is for educational purposes only. It is not medical advice, and it is not a substitute for working with your own licensed healthcare provider. If you're experiencing chest pain, severe dizziness, shortness of breath, or any sudden change in symptoms, please see a doctor immediately. Your heart and your kidneys are too important to gamble with. This video is about optimizing what you're already doing, safely, intelligently, and based on research. Now, let's count down from number 7. Number 7 is bananas. It's simple, it's inexpensive. You probably pass them in the grocery store every week without giving them a second thought. But for anyone taking Lisinopril, Losartan, or other ACE inhibitors and ARBs, bananas and the potassium they contain require a much more careful approach than you might think. And research backs that up. Here's why it matters. ACE inhibitors and ARBs work by blocking hormones that raise blood pressure, but they also tell your kidneys to hold on to potassium instead of flushing it out. That's usually fine until you start adding extra potassium from food or supplements without realizing it. Over time, potassium levels can climb too high, leading to a condition called hyperkalemia, and before you know it, you're experiencing irregular heartbeats, muscle weakness, and in severe cases, cardiac arrest. That's not just aging, that's potassium overload. And there's growing evidence that it's addressable. Bananas are loaded with potassium, about 420 milligrams per medium banana. Think of potassium as the electrical manager of your heart. It controls the rhythm, the contraction, the communication between cells. But too much of it creates a short circuit. ACE inhibitors and ARBs essentially put a lock on the exit door. Potassium can't leave your body as easily. The research here is meaningful. A 2021 study published in Hypertension found that patients taking ACE inhibitors who consumed more than 3,000 milligrams of potassium per day from food had a 40% higher risk of developing dangerous potassium levels, especially if they also had mild kidney impairment, which many seniors do, even if they don't know it. 1 banana a day. Measurable risk if you're not monitoring. So how do you use it? Keep it simple. If you're on Lisinopril or Losartan, limit potassium-rich foods to moderate amounts, 1 small banana per day, or half an avocado, or 1 cup of cooked spinach. Don't eliminate them entirely unless your doctor advises it, but don't go overboard either. Ask your doctor to check your potassium levels regularly, every 3 to 6 months, especially if you're over 70 or have any kidney issues. And here's a detail most people miss completely. Salt substitutes, like new salt or Morton salt substitute, are pure potassium chloride. A single teaspoon can contain 2,800 milligrams of potassium. If you're sprinkling that on your food while taking Lisinopril, You're essentially stacking potassium on top of a medication that's already holding on to it. That's how hyperkalemia happens silently. Something as ordinary as a banana, when managed properly, it's safe. When ignored, it's a genuine cardiac risk. No drama, just facts. Number 6 on our list is one you probably already love. And if you've ever wondered why your medication suddenly felt stronger, or your side effects got worse after breakfast, you'll want to hear this. Number 6 is grapefruit. It's refreshing. It's packed with vitamin C. You might have half a grapefruit with breakfast and think nothing of it. But for anyone taking amlodipine, a calcium channel blocker, grapefruit is genuinely problematic. And research backs that up. Here's why it matters. Your liver has a specific enzyme system called CYP3A4. Think of it as the cleanup crew that breaks down medications so they don't build up to dangerous levels in your bloodstream. Grapefruit contains compounds called furanocoumarins, and they shut down that enzyme. When you drink grapefruit juice or eat grapefruit while taking amlodipine, the medication doesn't get broken down properly. It accumulates, your blood levels spike, and before you know it, you're experiencing severe dizziness, dangerously low blood pressure, rapid heart rate, and swelling so bad you can't get your shoes on. That's not just a side effect, that's grapefruit-induced drug overdose. And there's growing evidence that it's entirely preventable. Grapefruit is loaded with furanocoumarins. Just one 8-ounce glass of grapefruit juice can block up to 47% of CYP3A4 activity for up to 24 hours. Think of it as putting a lock on your liver's ability to process the drug safely. Amlodipine levels can increase by up to 80%, meaning you're essentially getting almost double your prescribed dose. The research here is meaningful. A 2020 study in the British Journal of Clinical Pharmacology found that patients taking amlodipine who consumed grapefruit regularly experienced significantly higher rates of adverse cardiovascular events, including hypotension and edema, compared to those who avoided it entirely. One glass of juice, measurable danger. So how do you use it? Keep it simple. If you're on amlodipine, avoid grapefruit entirely, fresh, juiced, or in supplements. That includes Seville oranges used in marmalades, pomelos, and tangelos. Regular oranges and tangerines are generally safe. If you accidentally consume grapefruit, call your doctor or pharmacist immediately. Don't wait for symptoms. And here's a detail most people miss completely. The effect of grapefruit can last up to 72 hours in your system, so even if you stop drinking grapefruit juice, your liver enzyme activity may still be suppressed for days. That's why just having a little bit doesn't work. It's cumulative and it lingers. Something as healthy as grapefruit, when you're on the wrong medication, it becomes a cardiac liability. That's not fear, that's pharmacology. But the top 5 are even more powerful, including a mineral your medication is depleting right now that controls everything from your heartbeat to your sleep quality. Let's keep going. Number 5 is licorice root. It's subtle. It's in certain teas, candies, and herbal supplements. You might not even realize you're consuming it, but for anyone taking any blood pressure medication, especially Lisinopril or Losartan, licorice root can completely undermine your treatment. And research backs that up. Here's why it matters. Licorice root contains a compound called glycyrrhizin, and it works by mimicking a hormone that tells your kidneys to hold on to sodium and water while flushing out potassium. The result? Your blood pressure goes up, sometimes dramatically, even while you're taking medication designed to bring it down. Your potassium drops, your heart rhythm becomes unstable, and before you know it, you're experiencing muscle cramps, fatigue, irregular heartbeats, and your doctor is scratching their head wondering why your medication isn't working. That's not medication failure, that's licorice interference. And there's growing evidence that it's more common than people think. Licorice root is loaded with glycyrrhizin. Just 50 grams of black licorice candy per day, about 2 ounces, can raise blood pressure by up to 14 points systolic in sensitive individuals. Think of it as your medication stepping on the brakes while licorice is stepping on the gas. The two forces cancel each other out. Or worse, licorice wins. The research here is meaningful. A 2022 study in the American Journal of Medicine reported multiple cases of severe hypertension and hypokalemia, low potassium, in patients consuming licorice-containing herbal teas while taking ACE inhibitors. In one case, a 68-year-old woman's blood pressure spiked to 210/105, despite being compliant with her medication. Once the licorice was identified and stopped, her pressure normalized within a week. 2 ounces of candy, measurable cardiac crisis. So how do you use it? Keep it simple. If you're on any blood pressure medication, avoid natural licorice root entirely, in teas, supplements, and traditional black licorice candy. Check labels carefully. Licorice flavor, in red or strawberry licorice, is usually artificial and safe, but true black licorice from Europe often contains real glycyrrhizin. If you love the flavor, choose DGL, deglycyrrhizinated licorice, which has the harmful compound removed and is safe for blood pressure patients. And here's a detail most people miss completely. Many detox teas and digestive support herbal blends contain licorice root without listing it prominently on the front label. You have to read the full ingredient list. If you see Glycyrrhiza glabra or licorice root extract, put it back on the shelf. Something as innocent as herbal tea, when it contains licorice, it's sabotaging your blood pressure control from the inside. No pill, no procedure, just knowledge. Number 4 is magnesium. It's a mineral. It's quiet. It doesn't get the attention that calcium or vitamin D do. But for anyone taking amlodipine, lisinopril, or losartan, magnesium is genuinely one of the most important nutrients you can focus on. And research backs that up. Here's why it matters. Magnesium is involved in over 300 enzymatic reactions in your body, including the ones that relax your blood vessels, regulate your heartbeat, and control how your muscles contract and release. Many blood pressure medications, especially diuretics often prescribed alongside these drugs, actively deplete magnesium from your body. Your kidneys flush it out faster than you can replace it through food alone, and before you know it, you're experiencing leg cramps at night, heart palpitations, insomnia, anxiety, and muscle twitches that make you feel like your body is misfiring. That's not just aging, that's magnesium deficiency, and there's growing evidence that it's epidemic among seniors on blood pressure meds. Magnesium works as a natural calcium channel blocker, similar to amlodipine but gentler. It helps blood vessels relax, reducing resistance and lowering pressure naturally. Think of it as your body's built-in blood pressure regulator. But when magnesium is depleted, your vessels become stiff, your heart struggles to maintain rhythm, and your medication has to work harder to do the same job. The research here is meaningful. A 2023 meta-analysis published in Nutrients reviewed over 30 clinical trials and found that magnesium supplementation in patients taking antihypertensive medications resulted in an average reduction of 4.2 millimeters of mercury systolic and 2.8 millimeters of mercury diastolic blood pressure, enough to potentially reduce medication doses in many patients. The study also found that magnesium significantly reduced the incidence of leg cramps, insomnia, and heart palpitations, 3 of the most common complaints among seniors on blood pressure meds. Simple, mineral, measurable results. So, how do you use it? Keep it simple. Aim for 300 to 400 milligrams of magnesium per day from a combination of food and supplements. The best food sources include pumpkin seeds, 150 milligrams per ounce; spinach cooked, 157 milligrams per cup; dark chocolate, 70% plus cacao, 95 milligrams per ounce; almonds, 80 milligrams per ounce. If you supplement, choose magnesium glycinate or magnesium citrate. They're absorbed better and cause fewer digestive issues than magnesium oxide. Take it in the evening, about 1 to 2 hours before bed. It helps with sleep, muscle relaxation, and nighttime cramps. And here's a detail most people miss completely. If you're taking a diuretic like hydrochlorothiazide along with your blood pressure medication, which is common, you're losing magnesium even faster. In that case, you may need closer to 400 to 500 milligrams per day, and you should ask your doctor to check your magnesium levels every 6 months. Low magnesium also reduces potassium absorption, which means even if you're eating enough potassium, your body can't use it properly without adequate magnesium. They work as a team. Something as simple as magnesium, better blood pressure control, fewer cramps, better sleep. No pill needed beyond what you're already taking. That's support, not replacement. Quick question. Have you experienced leg cramps, insomnia, or heart palpitations since starting your blood pressure medication? Let me know in the comments below. Your experience may help other viewers who are dealing with similar challenges. The top 3 might actually surprise you, including one nutrient your heart is literally starving for right now. Let's keep going. Number 3 is coenzyme Q10, CoQ10. It's a compound your body makes naturally. It's in every cell, powering your heart, your muscles, your brain. But for anyone taking a statin alongside blood pressure medication, which many seniors are, or anyone over age 60, CoQ10 levels plummet. And research backs that up. Here's why it matters. CoQ10 is the spark plug of your cell's mitochondria, the tiny power plants that produce energy. Your heart, which beats over 100,000 times per day, needs massive amounts of CoQ10 to keep going. But as you age, your body produces less. And if you're taking a statin like atorvastatin or simvastatin, which block the same pathway that makes CoQ10, you're depleting it even faster. The result? Your heart muscle weakens. You feel exhausted. You can't climb stairs without getting winded. Your muscles ache constantly. And before you know it, you're experiencing symptoms of heart failure. Not because your medication isn't working, but because your heart is running on empty. That's not just aging, that's CoQ10 depletion. And there's growing evidence that it's both measurable and reversible. CoQ10 works as both an energy producer and a powerful antioxidant. Think of it as premium fuel for your heart. It protects the cells from damage while giving them the energy to contract powerfully and efficiently. Studies show that blood levels of CoQ10 drop by 40% or more in patients taking statins for just 6 months. The research here is meaningful. A 2021 study published in the Journal of the American College of Cardiology followed over 400 patients with heart failure who were also taking blood pressure medications. Those who supplemented with 200 to 300 milligrams of CoQ10 daily experienced significant improvement in ejection fraction, the heart's pumping strength, reduced fatigue and shortness of breath, lower rates of hospitalization for heart-related issues. The study concluded that CoQ10 supplementation was a safe, effective adjunct therapy for patients on cardiovascular medications. Simple supplement, measurable heart protection. So, how do you use it? Keep it simple. Supplement with 100 to 200 milligrams of CoQ10 per day, preferably the ubiquinol form, which is the active, reduced form that's easier for older adults to absorb. Take it with a meal that contains fat, like eggs, avocado, or nuts, because CoQ10 is fat-soluble. Without fat, absorption drops by over 60%. Best time? Morning or early afternoon with breakfast or lunch. Taking it too late in the day can interfere with sleep for some people because it boosts energy. And here's a detail most people miss completely. If you're taking warfarin, Coumadin, talk to your doctor before starting CoQ10. It has a chemical structure similar to vitamin K and may slightly reduce warfarin's effectiveness. Your INR levels may need monitoring. But for most people on blood pressure meds, especially if you're also on a statin, CoQ10 is one of the safest, most evidence-backed nutrients you can add. Something as simple as CoQ10, stronger heart, better energy, less fatigue. All from a nutrient your body used to make on its own, but can't anymore. That's restoration, not compensation. The top 2 may be the most important of all, including one that 80% of seniors are deficient in without even knowing it, and it's directly linked to blood pressure control. Let's keep going. Number 2 is vitamin D. It's called the sunshine vitamin. Most people associate it with bone health. But for cardiovascular health, especially for anyone taking Lisinopril, Losartan, or Amlodipine, vitamin D is genuinely critical. And research backs that up. Here's why it matters. Vitamin D is involved in regulating the renin-angiotensin system, the exact hormonal pathway that ACE inhibitors and ARBs target. It helps your blood vessels stay flexible, reduces inflammation in the arterial walls, and supports healthy endothelial function, the inner lining of your arteries. When you're deficient in vitamin D, which over 80% of seniors are, according to the National Institutes of Health, your blood pressure becomes harder to control, your arteries stiffen, and your medication has to work overtime just to keep up. And before you know it, you're taking higher doses, experiencing more side effects, and still not hitting your target blood pressure. That's not medication resistance, that's vitamin D deficiency. And there's growing evidence that it's one of the most overlooked factors in blood pressure management. Vitamin D works as a hormonal regulator. Think of it as the master switch that helps control how aggressively your body tries to raise blood pressure in response to perceived threats. When vitamin D is low, your body overproduces renin, the enzyme that kicks off the entire blood pressure-raising cascade. ACE inhibitors try to block that pathway, but if vitamin D is deficient, the pathway is overactive to begin with. The research here is meaningful. A 2022 study published in Hypertension followed over 2,000 adults with high blood pressure who were taking ACE inhibitors or ARBs. Those who brought their vitamin D levels up to optimal range, 40 to 60 nanograms per milliliter, experienced an average reduction of 6.2 millimeters of mercury systolic blood pressure. Better medication responsiveness, meaning their current dose worked more effectively. Reduced arterial stiffness measured by pulse wave velocity. The study concluded that vitamin D optimization should be considered a foundational element of blood pressure management in older adults. Simple vitamin, measurable cardiovascular protection. So how do you use it? Keep it simple. Get your vitamin D levels tested. Ask for a 25-hydroxy vitamin D test. Aim for a blood level of 40 to 60 nanograms per milliliter, not just the normal range of 30+, which is often too low for optimal cardiovascular health. Supplement with 2,000 to 4,000 IU of vitamin D3 per day, depending on your blood levels and your doctor's guidance. Vitamin D3, cholecalciferol, is more effective than D2, ergocalciferol. Take it with a meal that contains fat. Again, it's fat-soluble. Absorption without fat is poor. Best food sources include fatty fish, salmon, mackerel, fortified milk, egg yolks, and mushrooms exposed to sunlight. And here's a detail most people miss completely. Vitamin D works synergistically with magnesium. In fact, your body needs magnesium to convert vitamin D into its active form. If you're low in magnesium, which we talked about earlier, you can take all the vitamin D you want, and your body still won't be able to use it properly. That's why supplementing with both magnesium and vitamin D together is far more effective than either one alone. Something as simple as vitamin D, better blood pressure control, more responsive medication, healthier arteries, all from a nutrient most seniors are severely lacking. That's optimization, not overcomplication. And this final one may be the most important of all. It's something you do every single day, but most people are doing it wrong, and it's quietly undermining everything their medication is trying to accomplish. Let's finish strong. Number 1 is sodium, and specifically, when and how much you're consuming it. It's everywhere. It's in bread, cheese, canned soups, restaurant meals, frozen dinners. You might think you're being careful, but you're probably getting 3 to 4 times the amount your cardiovascular system can safely handle while on blood pressure medication. And for anyone taking any blood pressure medication, especially Amlodipine, Lisinopril, or Losartan, sodium intake is the single most powerful dietary factor that determines whether your medication works effectively or fails completely. And research backs that up. Here's why it matters. Your kidneys regulate blood pressure by balancing sodium and water. When you consume too much sodium, your kidneys hold on to extra water to dilute it, which increases blood volume and pressure. Blood pressure medications work by relaxing blood vessels or blocking hormones, but they can't overcome the relentless volume overload from excess sodium. It's like trying to drain a bathtub while the faucet is running full blast. And before you know it, your ankles are swollen, your blood pressure readings are creeping up despite medication, you're gaining water weight, and your doctor is increasing your dose or adding another drug. That's not medication failure, that's sodium overload. And there's growing evidence that it's the #1 modifiable factor in blood pressure control. Sodium works by creating osmotic pressure. Think of it as a sponge. Wherever sodium goes, water follows. The more sodium in your bloodstream, the more water your body holds onto, the harder your heart has to work to pump that extra volume through your arteries. The American Heart Association recommends no more than 1,500 milligrams of sodium per day for anyone with high blood pressure or over age 60. But the average American consumes over 3,400 milligrams per day, more than double the safe amount. The research here is meaningful. A 2023 study published in JAMA Cardiology followed over 5,000 adults on antihypertensive medications. Those who reduced their sodium intake to under 1,500 milligrams per day experienced an average reduction of 8.7 millimeters of mercury systolic blood pressure, comparable to adding a second medication. Significant reduction in edema, swelling, better kidney function markers, lower cardiovascular event rates over 5 years. The study emphasized that sodium reduction was more effective than medication dose increases in the majority of participants. One dietary change, measurable life-saving impact. So, how do you use it? Keep it simple. Track your sodium intake for 1 week. Read every label. You'll be shocked. A single can of soup can contain 1,800 milligrams, more than your entire daily limit. The biggest sources are processed and packaged foods, frozen meals, canned soups, deli meats, restaurant and fast food. 1 meal can exceed 3,000 milligrams. Bread and baked goods, surprisingly high, even if they don't taste salty. Cheese and condiments, ketchup, soy sauce, salad dressings. Cook at home as much as possible. Use fresh or frozen vegetables, lean proteins, and flavor with herbs, garlic, lemon, and spices instead of salt. If you eat out, ask for no added salt. Order sauces and dressings on the side, and avoid obviously salty items like fries, pizza, and Asian takeout. And here's a detail most people miss completely. The timing of sodium intake matters. Research shows that consuming most of your sodium early in the day gives your kidneys more time to process and eliminate it before bedtime. Eating a high-sodium meal at dinner or later, especially common with restaurant meals or processed frozen dinners, means your body is holding on to that sodium overnight, which spikes your blood pressure during sleep and puts extra strain on your heart when it should be resting. That's one reason why many people have higher blood pressure readings in the morning, nighttime sodium overload. If you must have something higher in sodium, have it at breakfast or lunch, and balance it with plenty of water and potassium-rich foods like bananas or sweet potatoes, in moderation, as we discussed earlier. Something as simple as sodium, managed correctly, it can reduce your blood pressure as much as a second medication, reduce swelling, protect your kidneys, all without a single extra pill. That's power. That's control. That's you taking charge. Now, before we wrap up, there are 3 rules I need you to hear, because without these, you could eat all the magnesium-rich foods, take all the CoQ10, avoid all the grapefruit, and still not get the full benefit. Rule 1. Don't take your medication with high-calcium foods or supplements. This surprises people. Calcium, especially in supplement form or in large amounts from dairy, can interfere with the absorption of certain blood pressure medications, particularly amlodipine and other calcium channel blockers. When you take amlodipine with a big glass of milk or a calcium supplement, the calcium competes for absorption in your gut. The result? You get less medication into your bloodstream than your doctor intended, and your blood pressure control suffers. Separate them by at least 2 to 3 hours. Take your medication with water in the morning and have your calcium-rich foods or supplements later in the day. If your blood pressure has been harder to control recently and you've been taking calcium, this could be why. Rule 2. Always stay hydrated, but not excessively. This one is a balancing act. Many blood pressure medications, especially ACE inhibitors and ARBs, work better when you're adequately hydrated. Dehydration makes your blood thicker, harder to pump, and can actually raise your blood pressure. But drinking too much water, especially if you're on a medication that affects kidney function, can dilute your electrolytes dangerously, leading to low sodium, hyponatremia, or other imbalances. Aim for about 6 to 8 glasses of water per day, more if it's hot or you're physically active, less if you have heart failure or kidney disease and your doctor has given you fluid restrictions. The key: drink consistently throughout the day, not all at once, and monitor your urine color. Pale yellow is ideal. Dark yellow means you need more water. Clear means you might be overdoing it. Rule 3. Never stop your medication suddenly without your doctor's guidance. This one is genuinely critical. I've shared a lot of information today about supporting your cardiovascular health naturally: magnesium, CoQ10, vitamin D, sodium reduction. And all of that is evidence-based and valuable. But none of it is a replacement for your prescribed medication. Stopping amlodipine, Lisinopril, or Losartan suddenly can cause rebound hypertension, a dangerous spike in blood pressure that can lead to stroke or heart attack. If you want to reduce your medication or try a different approach, work with your doctor. Show them this video if it helps. Ask about monitoring your blood pressure at home, adjusting your diet, adding supportive nutrients. But never, ever just stop taking your pills because you feel better or you read something online. Your heart and your brain are too important to gamble with. So let's bring it all together. High blood pressure and the medications you take to control it are not simply an inevitable, irreversible consequence of aging. They are often the result of specific, identifiable processes happening in your cardiovascular system, your kidneys, your cellular energy production, and your nutritional status. And growing evidence suggests that certain nutrients, magnesium, CoQ10, vitamin D, along with careful management of potassium, sodium, and medication interactions, can meaningfully support your body's natural ability to regulate blood pressure, reduce side effects, and protect your long-term heart health. Think about climbing stairs without getting winded, walking through the grocery store without your ankles swelling so badly you have to sit down, waking up in the morning and actually feeling rested, no dizziness, no dry cough, no muscle cramps that jolt you awake at 3 a.m., playing with your grandchildren without worrying that you'll suddenly feel faint, traveling to the places you've always dreamed of seeing, confident that your blood pressure is stable and your medication is working with your body, not against it. That's what this is really about. Not just numbers on a blood pressure cuff, your independence, your confidence, your quality of life. I want to hear from you now. If your blood pressure became consistently controlled tomorrow morning, if the side effects disappeared, if you felt strong and energized again, what's the very first thing you'd want to do? Your grandchildren? A trip you've been putting off? The garden you haven't had the energy to tend? Leave your answer in the comments. I read every single one, and I mean that. If this was helpful, please hit the like button and subscribe for more evidence-informed, practical approaches to protecting your heart health as you age. And share this with someone over 60 in your life. You might genuinely make a difference for them. A simple conversation about magnesium or sodium timing could prevent a hospitalization. That's not an exaggeration, that's reality. This is Dr. Samuel Whitaker. Take care of your heart. It's irreplaceable. And I'll see you in the next one.